ensuring a high standard of care, patient safety. It's something that really touches every single one of us, doesn't it, around the globe?
Absolutely.
But the systems and processes that, make that happen, they can feel a bit mysterious sometimes.
Yeah, sort of opaque.
Exactly. So today we're doing a deep dive into the work of these organizations, the ones really dedicated to lifting the bar in healthcare worldwide.
Absolutely. It's a significant international effort, yeah.
Yeah.
And a key player you'll often hear about is Joint Commission International, or JCI.
JCI?
Think of them as a global standard setter in healthcare quality and patient safety, of course.
Right.
They're active in, I think, over 70 countries and have over 1,000 accredited and certified programs. So that gives you a sense of their reach.
Wow, that's a truly global footprint. And it's fascinating to see similar efforts happening, on a national level, too.
Right.
Like in India, for instance, there's the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
NABH, yes. Heard of them.
They're doing really crucial work there. They're part of the Quality Council of India, focusing specifically on elevating healthcare standards within India.
Okay, so more country-specific.
Yeah, exactly. So while JCI has this really broad international scope, NABH is, you could say, laser-focused on the Indian healthcare landscape.
And what really unites organizations like JCI and NABH, I think, is their fundamental drive for quality improvement, QI, as it's often called.
QI, right. Quality improvement.
Yeah. And when we talk about QI, what we really mean is this continuous effort to make healthcare better. It leads to, hopefully, healthier patients and more efficient use of resources.
So it's not like a destination or a journey.
Exactly. It's not about reaching some finish line, but always looking for ways to enhance the system, improve things.
Okay. So in this deep dive, we're going to try and unpack the how behind all this crucial work. We'll explore the accreditation processes that JCI and NABH use and look at some of their other initiatives, too.
This goes good.
We've got some really interesting material here from their own descriptions, but also resources on, community health and investment in the sector.
Oh, excellent. Broad scope.
Yeah. Our goal is really to get under the hood of healthcare quality assurance, understand the mechanisms, that are designed to keep us, the patients, safe and well cared for.
Okay, let's start with accreditation itself then. What is it in this context?
Good question.
In healthcare, when an organization like JCI or NABH accredits a hospital or clinic, it's essentially, it's a stamp of approval.
Okay.
It signifies that they've met a specific set of predefined standards for quality and safety.
Right. So it's like an external check.
Kind of like an external audit, yeah, but really with the goal of driving improvement, not just ticking boxes.
And JCI's approach is built on some really rigorous international standards. Is that right? That seems key to how they evaluate.
That's correct. Those standards are the foundation.
And I noticed their emphasis on the international patient safety goals. Why are those so central? Could you explain that a bit?
Yeah, those goals are absolutely critical. Think of them as a focused effort on the areas where patients are most vulnerable, the biggest risks.
Okay, like what?
Well, for example, one goal might be improving the accuracy of patient identification. Making sure the right patient gets the right treatment, the right medication.
Seems fundamental.
It is. Another might focus on preventing healthcare-associated infections. So these goals target specific known risks in healthcare settings.
Got it. And turning to NABH then, you said they're India-focused.
Right. Their mission is specifically tailored to India. They aim to establish and operate these accreditation programs for healthcare organizations across the country.
So setting benchmarks for India.
Exactly. Setting benchmarks, but also trying to be really responsive to the unique needs of the Indian healthcare consumer. It's about that local context.
And it's interesting to hear about the actual impact of, say, JCI accreditation. We have some accounts from hospitals that went through it.
Oh, testimonials, good.
Yeah. Hong Kong Adventist hospitals, for instance, they described it as this powerful team-building exercise. It really improved how different departments talk to each other, work together.
See, that's more than just a certificate on the wall.
Exactly. It sounds like a real shift in their internal culture.
Precisely. It highlights that accreditation isn't just about compliance. It often catalyzes this internal transformation.
Makes sense.
Burjil Farha Hospital, another example, they emphasize the competitive edge they gained.
Oh, interesting.
Yeah, and the increased confidence it instilled in the community. It reinforces their commitment to patient safety, makes it visible.
So it builds trust.
Definitely. And Emirates Specialty Hospital echoed that. pointing to the added value and that stronger patient trust that comes with external validation.
Right.
And the fact that Cornish Hospital achieved JCI accreditation 6 times, well, that really underscores their ongoing dedication to keeping up those high international standards. It's not a one-and-done thing.
No, it definitely sounds like continuous effort. It paints a picture of real, tangible benefits way beyond just meeting a requirement. And it's also interesting that there are consultancies like Supreme Medic. They specialize in helping hospitals in India navigate the NABH accreditation process.
Right. That suggests there's a real demand, a real drive within the Indian healthcare system itself to achieve this kind of recognition.
Yeah, absolutely.
So let's delve a little deeper into what JCI accreditation actually involves, because it's quite comprehensive.
Okay.
Beyond the main accreditation programs for hospitals, they offer certifications for specific clinical care programs.
Like for specific diseases.
Exactly, say for diabetes management or stroke care. They even have a certification now for healthcare sustainability.
Sustainability? How so?
Looking at environmental impact, resource use, and another one for telehealth, recognizing how important remote care has become.
Wow, okay, so they're really adapting.
Yeah, it shows they're looking at quality from multiple angles, keeping up with the evolving healthcare landscape.
That seems really forward-thinking. And it sounds like they provide a whole suite of support services, too.
They do.
I noticed they offer advisory services, covering everything from just getting ready for accreditation initially
The prep work.
to very specific areas like infection prevention, managing medications safely, facility safety, emergency preparedness,
Yeah.
even policy creation.
Yeah, it's almost like they provide the toolbox and the guidance for ongoing improvement, helping organizations build that capacity internally.
Right.
And their standards, as we said, are the bedrock of all this. They provide that clear benchmark. Organizations can measure their current practices against it and then see where they need to improve.
And it's not just big hospitals they work with.
No, that's important. JCI works with a wide variety of healthcare organizations, ambulatory care centers, home care agencies, clinical laboratories.
Okay, quite broad.
Yeah. And it's not just about the evaluation itself, the survey visit. JCI also seems to be a real hub for knowledge and resources.
How so?
Well, they offer things like board education materials, helping leaders understand their role in quality. They provide up-to-date info on current health crises, like they did with coronavirus.
Right, very relevant.
Plus news, webinars, their JC Insight newsletter. It sounds like they're actively working to keep the whole healthcare community informed and connected.
Okay, so shifting gears a bit now, away from just the hospital accreditation focus, it seems vital to consider the bigger picture of quality improvement in public and community health.
Absolutely vital. This is where the focus expands, from individual facilities to the health and well-being of entire populations.
And the concept of QI, quality improvement, it takes on an even wider meaning here, doesn't it?
It really does.
It's not just about what happens inside a clinic, but about the overall effectiveness, the efficiency, and how well the public health system as a whole meets the community's needs.
Exactly. That resource on improving public health through quality initiatives really highlights this broader perspective.
Yeah, I thought so too.
It emphasizes that QI in public health is, again, a continuous journey. It's about enhancement.
Right.
It requires a certain mindset, one that embraces ongoing improvement. And it uses data. Data is key to inform decisions and track progress.
Data-driven decisions.
And collaboration is also absolutely essential. You need to bring together various stakeholders, community groups, healthcare providers, government agencies, everyone.
And it strikes me how crucial addressing health disparities is within this framework.
Hugely important.
Quality improvement efforts in public health really need to actively strive to ensure that everyone, regardless of background or circumstances, gets fair access to care and resources.
Equity is fundamental.
Plus, there's that proactive element, too, promoting healthy behaviors, preventing illness in the first place.
Precisely. And all of this has to be grounded in measurable outcomes. You need to be able to track whether your QI initiatives are actually making a tangible difference in community health.
You need to see the results.
Yeah. And crucially, there needs to be a culture of learning, a willingness to analyze what doesn't work, learn from failures, and use those insights to adapt and refine your strategies.
Makes sense. Some of the examples of QI in action in public health are really illuminating.
Like what?
Things like reducing hospital readmissions, through better discharge planning, better follow-up care.
Classic example.
Enhancing patient safety through system-wide protocols to cut down on errors and infections. Streamlining patient flow in clinics to reduce waiting times.
Yeah, making the experience better.
These are all concrete ways that QI translates into better healthcare experiences and ultimately better outcomes.
And it's not just about direct patient care, is it? It's also about improving the operational efficiency and effectiveness of the public health agencies themselves, making the system work better.
Right, the system as a whole. Now, when we focus specifically on quality improvement within community health systems, that source on quality improvement in community health systems was really insightful.
Ah, yes, that one.
It underscores how QI is really a strategic approach. It's aiming towards universal health coverage, the Sustainable Development Goals, especially in reaching underserved populations.
Absolutely. The core aims there are improving health outcomes at the community level, building trust between providers and the community.
Trust is huge.
And enhancing the efficiency of these vital public health systems, getting more bang for the buck, essentially.
And those foundational pillars of quality in this community context, they're so important to grasp.
What stood out to you?
Well, it's not just about access, can people get care, but also effectiveness. Are the treatments based on evidence? Do they work?
Right. Evidence-based practice.
Safety obviously is paramount.
Yeah.
And equity, again, making sure marginalized groups aren't left behind.
Crucial.
Then there's efficiency, using resources wisely, and maybe most importantly, keeping people, the community, at the center of it all. People-centeredness.
Couldn't agree more. And there are specific QI frameworks that are particularly useful in these community health settings.
Like the PDSA cycles.
Exactly. Plan, Do, Study Act. It's all about making small, rapid tests of change and learning quickly.
Try something small, see what happens.
Yeah, pretty much. See what happens, learn, adapt based on the results. Then there are methodologies like Six Sigma and Lean.
More from the business world.
Originally, yeah. But applied here, they focus on reducing waste and streamlining processes. So in community health, maybe reducing the time it takes to deliver essential medicines.
Okay, practical stuff.
The Donabedian model is also useful thinking about quality in terms of structure, resources, organization, process, how care is delivered, and outcome, the impact on health.
Structure, process, outcome. Got it.
And we also see tools like the WHO Primary Healthcare Performance Framework and community scorecards, which actually involve the community in assessing and improving their local health services.
Getting the community involved directly.
Yeah, empowering them.
The examples of QI interventions in areas like maternal and child health, immunizations, NCD screening, they really bring this to life. Using checklists during antenatal visits, sending SMS reminders for vaccinations, using mobile health vans for NCD screening in remote areas, it shows how these principles turn into real actions.
Practical applications, yeah.
That case study about reducing maternal deaths in rural India was particularly powerful.
Remind me of the details.
They implemented training for health workers, used logbooks for referrals, did community education, and achieved a remarkable 42% drop in maternal mortality in just 1 year.
Wow, 42%. That's incredible. A really compelling example of the impact of targeted QI.
It really is. And it's clear that technology is becoming a huge enabler for QI in community health.
Oh, absolutely. More and more so.
Mobile health apps for tracking patient data, sending alerts, digital scorecards for real-time monitoring.
Yeah, dashboards and things.
AI-powered chatbots for initial health checks, GIS mapping for tracking disease outbreaks, even online platforms for remote training of health workers.
It's all contributing to more effective, more efficient quality improvement, extending reach, improving data.
Definitely. Ultimately, it seems like fostering a strong culture of quality improvement within these community health systems is paramount.
Culture is key. It has to be embedded.
So that involves embedding QI principles in national health programs, right? Empowering local teams with data and tools.
Giving them ownership.
Actively getting feedback from the community and acting on it. Forging strong partnerships between different players.
Yeah, breaking down silos.
And recognizing and celebrating the efforts of those QI champions on the ground.
Recognition is so important for motivation.
Yeah. That transforming public health with community QI resource really ties this all together well. It reiterates that core focus, improving health system performance at the population level. And it gives those impactful examples like reducing maternal deaths, boosting vaccination rates.
And those key steps they outline are crucial. Identifying the gaps first.
Right. Know where the problems are.
Using data to really understand them. then implementing and rigorously testing potential solutions.
The testing part is important.
Not just assuming it works. And then continuously monitoring progress using community-based indicators. It's iterative and collaborative.
And the priority areas, they list MCH, immunization, NCDs, communicable diseases like PB, even WAURH and digital health access. It shows the sheer breadth of community health needs that QI needs to tackle.
It's a wide range. And the specific QI models they discuss, like those rapid PDSA cycles we mentioned, and the systematization offered by things like 5S CQI-TQM, which is about organizing community clinics efficiently, they provide practical frameworks for teams on the ground.
Tools they can actually use.
Right. And the emphasis on collaborative learning models, sharing knowledge, sharing best practices across different communities. That's really vital too. Learn from each other.
Definitely. Those real-life success stories are so encouraging.
Yeah. Which ones?
Like the safe motherhood checklists in Bihar leading to much higher rates of women delivering in facilities.
Oh, right. Institutional deliveries. Huge impact.
Or the NCD camps in Maharashtra, improving blood pressure control through digital follow-up. Or the diarrhea management campaign in Rajasthan cutting hospitalizations.
See, tangible results. It shows this stuff really works when it's done well.
But it's also important to be realistic about the challenges, right?
What challenges did they highlight?
Things like gaps in data availability. You can't improve what you can't measure easily. Staff burnout, which is a huge issue.
Understandable. It's demanding work.
Low community trust in some places. Inconsistent supervision of health workers. And various cultural barriers that you need to navigate really sensitively.
All very real obstacles. But they also mentioned enablers, right? Things that help overcome these.
Yes. Strong local leadership is key. Using tech tools effectively. Recognizing and rewarding frontline workers, like we said. Using community scorecards to build accountability. And linking QI efforts to incentives where possible.
Valuable strategies for sure.
And looking ahead, the future of community QI in India seems to be heading towards more integration. Integrated health and wellness centers offering broader services, leveraging digital dashboards for better data use, empowering local community QI champions,
grassroots involvement,
using AI-powered analytics for deeper insights, and generally shifting towards more proactive, preventive care, not just reactive treatment.
Positive direction.
Finally, we can't really wrap this up without talking about the role of investment and partnerships.
Absolutely critical. They underpin so much of this work.
That perspective from Supreme Medic Healthcare Investment Partnership was interesting. It highlights how strategic investment and collaboration can really help bring innovative healthcare solutions to life, including providing that crucial support for navigating accreditation processes, like NABH, which brings us full circle.
Right. Investment can grease the wheels for quality initiatives. And organizations like iSquad, the International Society for Quality in Healthcare, they serve as this crucial global network.
iSquad. Okay.
They foster quality improvement worldwide through education, sharing knowledge, supporting evaluation processes, strengthening health systems. They operate across more than 70 countries, too.
So another global player connecting people.
Exactly. It really underscores that improving healthcare quality is a collective responsibility. It truly transcends borders.
Absolutely. It requires this coordinated, collaborative effort, doesn't it? Involving the accreditation bodies like JCI and NABH, the healthcare providers on the front lines, the consultants offering expertise, governments setting policy.
It's engaged communities giving feedback.
And even investors who see the value in high-quality healthcare. It takes everyone.
It really does. So as we bring this deep dive to a close, we've seen how organizations like JCI and NABH play this really critical role, haven't they? Setting standards, accrediting providers against rigorous benchmarks.
All aiming for higher quality, safer care.
Exactly. And it's clear, I think, that this isn't a one-time thing. It's an ongoing commitment.
A continuous quality improvement. That phrase keeps coming up.
Because it's essential. Whether it's happening in a big hospital or a small community clinic, it's absolutely fundamental for achieving better health outcomes for individuals.
And for building stronger, more resilient health systems overall, systems that serve everyone effectively.
Hopefully, this deep dive has given you, our listeners, a clearer understanding of the intricate mechanisms working behind the scenes to ensure healthcare quality.
Yeah, lifting the veil a bit.
And as a patient, as a member of your community, having this knowledge can actually empower you. It helps you have higher expectations, maybe advocate for the best possible care.
That's a great point. Understanding empowers advocacy.
So maybe a final thought to leave you with is to consider that interconnectedness, how global standards and very local initiatives are all part of this shared effort, striving towards a healthier future for everyone.